Welcome to another edition of Inside Talk. Today we're meeting in Berlin at the largest European and the third largest global conference for orthopedic and trauma surgery. And I have with me two truly fascinating persons, surgeons who had a good career so far, and I'm really proud to have them here for this little conversation at the edge of the conference. So on my right hand side is Annika Hättich from the University Hospital of Hamburg. And opposite to her is Prof. Katthagen from the University of Münster. I would like to start with Christoph first. So, one day of conference, what are your impressions so far?
It's great. It's more or less the same every year. It's a very large conference. We meet many people we know from different countries, universities, hospitals, obviously across Europe more or less, because we have Switzerland and Germany also, and Austria also here. The setting is known, and I think the atmosphere is very good.
And Annika, for you, is this the highlight of the year?
Well, actually, I have to admit one personal highlight for myself was the anniversary of our Young Forum, the Young Forum of the German Society for Orthopedic and Trauma Surgery, because we were founded 20 years ago, and so today we wanted to celebrate, and we invited the members or the founders of the Young Forum, who founded it 20 years ago in a bar in the US. And one of the founders is my chief, Professor Prof. And so today we just took all the members together, and we just wanted to talk about the history of the Young Forum, and we just saw what became of the 5 members 20 years ago to the very huge society today, and it was a highlight for me, yeah.
How many members do you have right now?
I think we got like 50 or 60 very active members and a lot of, followers today who are a little bit more passive, but also very interested in our topics.
I researched a little bit, so I saw in the board there are 3 people, and all of them are women. Is this a coincidence?
Well, maybe not. Maybe at this time. I think the founders, they were all men, I know it, but today there are some topics I think maybe we women care about a little bit more than maybe the men do, like family, like the environment, and I think because we wanted to change something for us women, we were a little bit more active than the men 5 or 6 years ago. But right now it's changing a little bit, so we are maybe 50-50 or 40-60 men and women, and I think this is a very, very good thing. We don't have to be all women.
Thank you very much. And switching back to Christoph, so when we look a bit more on from a strategic perspective, what do you think were the major trends in the last 3-4 years in orthopedic surgery?
I think one main term is individualized treatment, because with implants, with planning tools, with the entire setup we have in daily routine, we're getting more and more into a single case rather than to one size fits all. So that's one of the biggest changes, I guess. Another big change in surgery all over is that we are going much more towards evidence. So evidence used to be much lower, and now there's really kind of a movement going to, we want more evidence, we want level 1 evidence for what we do. And these are, I think, the 2 main changes. Obviously, digitalization is everywhere, so also for us. Although there are some things that could be moving much more forward, I guess, but due to costs of development, we're not getting there so fast, but yeah.
And I also saw on your website, in your description, you're also applying artificial intelligence. Can you tell us a bit more about that?
Yeah, so we look into analysis of mass data. At first now this is healthcare data that we get from insurance companies, or we can use from insurance companies to apply certain questions and look at it with statistical methods. But then in the next step we have artificial intelligence, neural networks and similar things running over to kind of give a prediction of how a treatment, for example, would go for an individual patient. And we will get there more and more with clinical data from from the lab, from X-rays, also from PROMs, so patient-related outcome measures and things like this, will go into these tools of analysis more and more. Also with the idea to be more individualized with a treatment decision.
And are you happy with the progress, with the speed of change?
Obviously, we have some kind of visions, and we would like to have them fulfilled next week or at best yesterday. So it feels like it's going too slow, although we're doing huge improvements, I would say, every year. I mean, these things are very expensive because they're time-consuming, and you need a lot of human resources to work on it next to the computer, because it needs to be, you need to feed it with expertise, and so the resources could be more, but I have the impression that we're getting there. It's improving.
And Annika, are there any seasonality in your job?
Actually, yeah, sometimes you can't really plan it, because when you think there are holidays and all the people are gone and maybe lying at the beach in Spain or Italy or somewhere else, they might come back somewhere and then they hurt their knees or have some sport injuries. Or when I always thought, okay, when I move to Hamburg, nobody will have a skiing injury because there are no mountains and there's actually no snow in Hamburg, but they travel to the mountains and then they come back with their ACL or any injury, and so we treat them too. But actually we see when the people are in holiday times, it's a little bit quieter. And but if it's getting cold and icy, then we get some distal radius fractures or proximal femur, and I think these are some seasons when we work a little bit more here.
Maybe, Christoph, for you, I mean, we see now e-vehicles, we see safer cars, we have also an aging population, we have urbanization, many trends that change commuting and work life of the human beings, especially in Western world. What is, in your opinion, is the major trend today, and what might be the major trend that has an impact on your activities in the hospital?
Yeah. As you mentioned, one of the main changes is how people are moving. So people are moving a lot with two-wheeled vehicles, whatever this is, and a lot of them are with electrical motorization. But I often say when we talk about these topics that people always have been very creative and will be very creative in how they kind of harm themselves, because they need something new, they need the risk, something is always going on. So we see changes in injury patterns. Classic after a weekend is something like 10 or 20 cranial maxillofacial injuries of people rolling into a parking vehicle with their e-scooter. That's new. We also see elderly people that are motorized or are mobile with this type of vehicle, so that's changing. But I think it's just that the patterns of injury change, but people always need some kind of action, and I don't think with an aging society even more we see a lot of geriatric trauma, and it will become much more. So for the question of which will be the biggest change, a game changer, or what will be the biggest impact, I don't think it's the e-scooters. I think it's the aging society, and we will feel this more and more coming up.
Anything to add from your side, Annika?
No, actually, I think it's the same. We also see the people who are getting older but are still using their electronic bikes or anything like this. And when they fell with a higher speed, then they get injuries of their head or the hip. And I saw some people even dying because of head injuries mostly. And I can remember because when my grandmother became 80, we had a present, an electronic bike. And I think she drove it one time. And then she said, no, I don't want to use it because it's too fast for me. And I don't know how to move and what might happen when I fell. And so she took her 50-year-old bike again, but it was okay for her. But as Christoph said, the people want to be mobile and active, and so I think we just have to think how to handle the problems which might occur.
Annika, you deserve a lot of your time, if I follow you on social media, on training and also training and learning, transfer that understanding also to younger fellows. Recently you've been in Latin America, so you've been teaching in Brazil, Costa Rica and Argentina. Do you see any differences in the healthcare system in terms of education level and also treatment of care?
Yeah, actually I did, and I listened to Christoph before when we were talking about new technologies, because I think maybe we are a little bit spoiled in Germany or also in Austria and Switzerland, because we mostly can use the newest technologies that are on the market. And the people or the doctors in South and Latin America are very, very clever and educated, and they read a lot and they do also research. But when it comes to implants and new technologies, they are a little bit behind. But it also works. They do good medicine, and I think they always know what to do, and sometimes to handle situations with not that much of technology. But it was very interesting to see, and I saw one very, very good educated hand surgeon in Mexico, and she was so proud that she was the first surgeon to use the Medatis FPL plate for the distal radius, which is quite common in our hospital, and we can choose between this and this plate. And it was so special for her that I thought, okay, well, it was nice to hear, but also a little bit sad that it's not useful for everybody in the world. Yeah.
Christoph, have you made similar observation while traveling abroad?
Yeah, yes and no. So I think there are excellent healthcare professionals in every country, because there are people that they want to be good at their profession, and even if they don't have the tools. So my traveling experience abroad or medical is more in North America, which is probably pretty similar to what we have here or in Switzerland. But what we see, for example, in AO sports courses, we have, the presidents of the sports societies of Indonesia or other countries coming to principals courses and telling us they've never seen some of these techniques, for example. So this is one big difference. I don't think that people are excellent everywhere, and if they want to be, then anyway, but they don't have the same means in many countries. And there's a European complications seminar also held by the AO, and when we discuss these cases, sometimes we say, why didn't you use a nail, for example? And then they say, well, we only have plates in our hospitals, I can't use a nail. So as Annika said, we have some kind of luxury problems here with a big choice of implants, and I think we can help with training and teaching things, but we can also learn from other countries with less possibilities of how to deal with medical problems in a good way with less tools.
We talked a lot about instrumentation and implants. What about education? I mean, you know that the Medartis, in collaboration with the International Bone Research Association, has opened in Basel a modern lab where you can go in, train, and even place implants on pre-fractured bones, the specimens. Is that something which is important also for younger doctors to learn and get the practical training?
Yeah, so it's not just important, I think it's super important. And why would someone operate on a living person, some surgery first time, whilst people flying in aircraft have to train it 200 or 500 times on a simulator? So resources are getting less. We have less possibility to treat surgically because we have less OR time. Everything needs to be faster, more efficient, less complications. And so teaching hours go. And then we talked about the working hours. And even if 60 hours is a lot, or 70 or 50, it's still less than was possible maybe 20 years ago. So the hours dedicated into training for some specialization, which are regulated, are much less. So yes, we definitely need training centers, independent of which society, association, company, with digital tools, with human specimen training, and I mean, I've been part of IBRA courses, of AO courses and so on, different. There are other companies out there doing these things, and we always learn something, and we need them. And it's very good that Mid-Artis is also a part of this.
And both of you have something in common. You're young, you're talented, and you had made an impressive career so far. If you want to give a hint or a tip to someone, to a younger fellow, what would that consideration or advice be? Maybe we start with Annika first.
Big question. Well, I think don't be afraid. Go outwards, speak to other colleagues, speak to specialists, and maybe ask if you can take part of like a course or look at or watch a surgery and ask questions, because if you don't understand anything, and if you don't ask, then nobody will answer your question.
What about you, Christoph?
So I think one would be try to see the chances that are out there and take them, because there's a lot of, as you mentioned, training possibilities, facilities, even in places where we work, which can be used more. So take the chances you get is one. Second is probably complain less and try to think in solutions. So if you see something is not good, stop complaining about it. Help us and yourself by giving good ideas of how to make it better. And I always believe the extra 5% make the difference, because we have so many very good people. And if you want to kind of be a game changer or try to achieve a little more, you probably have to invest a little more, and the extra 5% make a big difference in my eyes.
Well, great statement. So we have to think big. We have to apply a positive attitude and grasp opportunities if they arise, if I can recap what you just said. Thank you very much to both of you for being part here of this Insight Talk. It was really impressive. I'm sure we will hear more from you going forward. I wish you all the best for your future career. And for you, dear listeners, hopefully we'll see each other again when you tune in for the next Insight Talk.